Good evening. My name is Javier Chinelli. I'm from Uruguay. I would like to thank Sages and Dr. De La Fuente for the invitation to participate. I'm going to be speaking about the importance of timeouts and debriefs. Now, the operating room is a complex environment combining the presence of technology, sometimes advanced, and humans. This is a paper many of you may be familiar with. It was published more than 20 years ago, stating that error is part of the human essence. Yet, as humans, we also have the capability to design strategies to minimize the impact of adverse events. In 2003, the Joint Commission promoted the Universal Protocol, which consists of 3 items, one of these being the timeout, so that the surgical team agrees at least on correct patient, correct site, and correct procedure. In the same way, in 2008, the World Health Organization launched the Surgical Safety Checklist that includes a timeout before the first incision and also a debrief once the procedure has finished. This is a very precise definition of what a timeout is about. A timeout is a surgical team's short pause just before incision to confirm that they are about to perform the correct procedure on the correct body part of the correct patient. Here's the time when anyone can speak up. Anyone should be able to call for the timeout. Although in the operating room, this is usually done by the circulating nurse or even the surgeon. Here's a picture where you can see the questions that have to be answered during the timeout and those issues that need special attention. A timeout is that moment when the whole team refocuses on the patient. It has many potential advantages. It promotes team spirit, it's easy to perform, it costs nothing, it can be repeated if necessary, and I think the most important of it, it takes less than a minute, so there are no excuses for its omission. But we must also be aware of incorrect ways to perform a timeout, and let's take a look at the definitions. We have a borderline timeout, which is the one that has everything checked except for patient's ID. We have a related timeout, when nothing about the team and the procedure is checked. The contrary timeout is done in a quick and passive way, just as if you want to get rid of it. We have the invented timeout, which is done, but nobody actually pays attention to it. And last, the illegitimate, when no timeout at all is carried on. And we have some other drawbacks, which are the surgeon's tight schedules, as well as lack of awareness of the importance of timeouts. And I think they both contribute to the real problem, which is its poor compliance. So in order to deal with this problem, some strategies have been proposed, such as the Mount Carmel's health system that includes sterilized metal plates with a timeout description in the box of the instrument sets. And we also have the National Timeout Day, which is promoted by the AORN on the 9th of June every year, just to remind everyone about the importance of it. Now let's move to the debriefs. This process promotes discussion of individual and team level performance to identify errors and to develop a plan to improve. So what's the purpose of debriefing? Identify failures, near failures, but also successes. So the aim of it is to provide experiential learning after all. And when should we do it? The recommendation is to do it immediately after the procedure has finished, when all the important information is still close at hand. First of all, we must know that debriefing and feedback are not the same thing. While feedback is a given information of a trainee's performance compared to a standard in order to improve, we could say that debriefing is more like a dialogue between instructors and students, and the aim is to co-create new insights. In spite of this, they both help in reducing adverse events, in improving performance, and ensured relevant learning. And the concept of debriefs comes from World War II, as it was used in fighter pilots training when they were interrogated after a mission. And I think debriefing applies well in the field of surgery if we take into account that just like in the military combat, the consequences of mistakes can be truly dramatic in both settings. This interesting article summarizes the key components of an adequate process of debriefing, and they have to be diagnostic of relevant problems. They must provide an adequate environment, which has to be supportive and non-judgmental. This is especially important from the trainee's perspective. It has to focus on learning through different types of feedback, and they must record conclusions made and state goals for future debriefs. And of course, as we stated with timeouts, the process of debriefing will find some drawbacks. One of them might be the disagreement among the members of the team regarding, for example, the timing. Trainers would rather do it during the procedure, and it has been observed that trainees prefer to do it afterwards. And another one is the different perception of its utility. And in this point, sadly, surgeons, unlike other members of the team, are more prone to think of it more as a waste of time. And this is not surprising since changes in practice will always meet with some kind of resistance at the beginning. So, in conclusions, we could say that timeouts and debriefs have a positive impact on patient safety, as well as in teamwork and communication. They both just take a few minutes. So, as I said before, there are no excuses for their omission. And some of the main drawbacks are their lower compliance, especially among surgeons. Thanks.